Excellent. Hopefully people can hear me. Hopefully Dion can let everybody in as we're chatting. So, good evening, everybody. It's 6 o'clock. Welcome to the latest in our series of men's health webinars. My name's Tara Belcher and I'm a GP in Hitchin and the Clinical Director of Hitchin and Whitwell Primary Care Network. We brought these webinars to you with support from EveryoneActive. Mark Kear is from EveryoneActive. We'll introduce them in a minute, and also Pine Hill Hospital. And as I say, this is one of a series of webinars that we've done. So if you've missed any so far, you can catch up on our PCN website. There's links to all of those webinars and they're all on YouTube. So tonight I am delighted to welcome Mark Kear back from EveryoneActive. He's here to talk to us about musculoskeletal issues that we might all, well, I say we, it's men's health, but that we might all face. And after Mark's presentation, there will be time for questions. So please do put any questions you've got in the chat or in the Q&As. And Dion, who's our PCN operations manager, and myself will be keeping an eye on those and we'll pick them up when we get to the end of the presentation. So without further ado, I'll hand over to Mark.
Yeah, hi everyone. So thank you for that introduction. So I'm Mark, I'm the fitness manager over at EveryoneActive in Stevenage. We'll be going through musculoskeletal issues, some injuries, some recommendations to try and starve off any of those problems or potentially fix and improve on in the future. So we'll start going through these slides. So get on to the next one there. Lovely. So backs. Let's just move this out of the way. There we go. So the large majority of adults, and that between 60 and 80%, will suffer from back pain at some point in their lives. Now, a lot of this can be defined as non-specific, so no specific reason, injury or trauma for that pain. It could just be degenerative and say over time. Now, many of the back pain we end up dealing with commits to several of the reasons we've listed below. So it could be a decrease in physical activity. So again, as over time, maybe less physical jobs, less activity in our everyday lives, whether that be work, gym or hobbies that we're now doing less of. An increase there is now in desk jobs, so people sitting with bad posture for extended periods of time. Occupations which encourage bad posture, an increase in obesity. The first kind of four lead on to the increase in obesity, and that extra weight we know can cause back pain. Muscle imbalance again leads back to that decrease in physical activity. Not talking about just gym here. It could be, say, your everyday life activity and hobbies, or there obviously is the opportunity for us all to pick up injuries doing whatever we maybe do for our either leisure, job, fun, etc. So what can go wrong? We can tear some muscle fibers, so our standard strains or tears in the muscle. Hyperflexibility, so say really, but yeah, bending, stretching, leaning too much with weakened muscle can cause that, say, that instability. Ligament tears and sprains. Quite common now, this one would be disc strains, bulging, protrusion, or ruptures that can be very, very, very painful and can take a long time to heal. Facet joint tears. This next one, inflammation, is a cause of many, many pains within the body, but inflammation of your nerves, your entrapments, your pinches, sciatica. Vertebral column injuries, such as your fractures and incomplete or partial dislocations of a joint. That's normally come from, say, that is some sort of trauma or maybe bad lifting technique in the gym, which we're more than happy to help try and correct. And something like osteoporosis, thinning of the bones. And this is where your weight-bearing activity really comes to pass. So that doesn't have to be weight training. That could be working in an allotment, just physical activity in general. But that lifting of weight is so important to help with osteoporosis. So the anatomy of the spine and how that's made up. So it's made up of 33 vertebrae. And starting from the top, so up in your neck, we have 7. Oh, backed out on me there. Oh no, it's come back. There we go. I hope you caught that. So 12 thoracic in the upper back, 5 lumbar, and you often hear when, certainly if you've worked in any sort of office job, we do a lot of lumbar support, making sure you've got the right chairs when you're going to be sitting at an office desk or on a laptop for extended periods of times. The sacrum, the 5 fused bones down the bottom there, and then the 4 fused coccyx bones right at the base. Now you have 23 discs separating those vertebrae, and when we talk about slip discs, they don't slip and fall out completely. It's often a bulge that ends up touching on those nerves that cause the big sharp pains which we all dread, and hopefully it managed to avoid by building up those muscles around that in the back area. So this is a great way to think of the spine, and say rather like a tall ship, as a very similar mechanism. Oh, my lights have just gone out. Sorry, folks. On its own, it is likely to fall with minimal interference, but with the restrained ropes and cables, it can withstand severe elemental forces. Now, this is where the muscles come in, and where the training and the lifting, the mobility, all come to pass. So if we have muscle weakness or imbalances, they're not all pulling at the same tension, which is where we can get those bulges and protrusions in the spine. So it's important when we're doing our activity, and I'll talk from a gym perspective here, that we need to hit all elements of that training. So we need to be doing our stretching and mobility, your holistic type of training, such as your yoga and Pilates. We then need to work on the strength, the muscle building aspect of that training, to make sure that everything is well supported, and that we're working the body in equal measure from say all sides, to make sure the back's nice and strong and can withstand those random moments where maybe a little bit of a trip and a fall, where you jolt in the back, that it all pulls in the right direction and everything stays where it should. So we're very keen on working that core part of it. You'll hear the word core a lot in the gym, and it's that nice brace around the spine and the stomach, the transverse abdominis, keeping the muscles, that belt nice and secure to protect that spine. So a few different conditions with the spine, certainly the most common. So as you can see by the diagrams here, number 1, we'll always put the normal version up. The number 1 is how our spine should look. It's got kind of a gentle S shape to it. And this is one of the more increasingly common, and it's due again to the different in levels of activity compared to previous generations, really. So this extra arch at the top, or extra bend, again, it's a lot of the time because we spend so much time now on computers, on phones, that we end up adopting this hunched position, which really tightens the muscles in the chest and the shoulders, and can make it quite a permanent problem if we don't work to correct it a lot of the time. We'll see in a future slide with the evolution of man, and it's a diagram I'm sure we've all seen lots and lots of times, going from very bent over to upright. There is almost a thesis now where we're going back the other way because we spend so much time desk bound. So it's really important to work on that posture, and that's where your yoga, Pilates type classes are starting to become really, really big growers within the gym world again, trying to help correct that posture, correct them in imbalances. So lordosis is more exaggerated in the lumbar curve. Again, on the left-hand side of the screen is how it should look. And that curve there, although, again, it doesn't seem massive, really makes a big difference to the spine and to those nerves that end up getting squashed up in the lower part of that back. A lot of people, certainly desk workers, will get this very common. It feels almost sometimes you're trying to get out of a chair and everything does feel very compressed. We have to do these big stretches and things that, again, one that's really great in the gym we try and get everyone to do. It's just it's a hang now. You hang on the bars and you just let the body stretch back out, and it gives tremendous relief to that lower part of the back. For the most part, this can, again, largely be, it's going to be hereditary. And it can, although mainly based in the lower part of the spine, can also occur a little bit higher up. Other causes: pregnancy, lots of abdominal fat, so all around the stomach and the organs. Again, it's that extra weight. You're trying to bounce your body out, trying to stay on bounce, and to do that, you'll arch your back a little bit more to compensate for the heavier muscle at the front, the weight at the front. Sorry. And that tightens those lower back muscles. So again, good posture. Trying to work on that. If you do sit down a lot in your job, trying to keep that core engaged, that belly tucked in. The more you can work those muscles, again, the more they'll act for you without you having to think about it too much. Seeing a lot of this at the moment, scoliosis. So again, you're looking at the spine from, say, directly from behind here. It should be nice and straight, and you can see this really quite well if you're getting, certainly if I get clients in that have shorter shirts or tighter shirts, you can really see that curvature in the spine. Now, many causes, and say, but not limited to, birth defects, limb length imbalance, cerebral palsy, and spina bifida. It's diagnosed by that left to right, or vice versa, but a curve of more than 10 degrees. Now, it can happen at any point in the spine, in the spine, and the severity, again, it's quite wide ranging. Correctable, again, through, or partially correctable through exercise, and you can do a lot to help support the imbalance by training the right way. Definitely worth speaking to the GP kind of exercise referral teams, because it's a very specific type of exercise we like to do to try and correct these imbalances. It has to be done much more gradually. We don't want to over focus on one side too much on the other. But again, if you're doing the wrong type of exercise, you're just going to put extra stress through the spine. So it's very gentle, very holistic again. But there is still good weight training routines that we can do with this. We just have to make sure you're engaging the right muscles. Quite often with this, we see a big imbalance in the glutes and a lot of tension in the neck when people are, so being able to drop the shoulders, relax the body into the routine, and then pull in with as much kind of muscle symmetry as we can without overemphasizing on one side. So, I mean, I don't know how many offices use stability balls instead of chairs, or if you've got stability balls at home. They were very big a few years ago. Gyms still do have them in. They have them in most stretching areas. Really good. You can do a lot of small movements, certainly with tilting the pelvis here. Again, use them a lot with the various spinal conditions that we just looked at. But this is good for everybody. And on top of using this sort of exercise, there's always a few little extra cheat sheets you can use at home. Things like if you're brushing your teeth, bouncing on one leg for a little while. if you're making your toast, bouncing on the other leg. Because to do these things, you need to engage your core, tighten that stomach, and you'll repeat those things several times a day. And that's why when they talk about 10,000 repetitions to reprogram our body, you can't do that just in a gym. That needs to be part of everything you do at home, just in small segments. Like I said, if you're making a cup of tea, you're making some toast, you're brushing your teeth, brushing your hair, stand on one leg just for 10, 15 seconds, swap to the other leg, keep practicing tightening that core. And before long, the body starts to do it almost on your behalf. It takes minimal thought. So as much as you can. If you have a stability ball, then great. Again, the guys and girls at the gym can show you several exercises on the stability ball to help increase your repertoire. But even just that sitting there, if you're watching TV, typing on your laptop, again, to do it and not fall off, you have to engage that core. So posture. We'll get towards the slide I was talking about earlier. So this very common now, very common postural position for us. So forward rounded shoulders. I always have to correct myself on this one, certainly with the amount of time I'm on my laptop. You start to get this little bit of an arched back. We bring our heads forward. Again, massive increase in this as a general position for reading things on our phones, of which most people's social media is on these days. But you'll still do it while you're on the laptop or desktop computer for that matter. That flattened curve at the bottom of the spine, when with both hips tilted under, it starts to pull and it gives a tremendous force. So I'm pointing at the screen, but at the very bottom of that spine there where you can see the arrow tilting forward. Even as much as starts to change positions of where we can then put our hands comfortably, because you end up with tight shoulders and tight chest, it pulls those hands forward. So you very much end up with the front of your hand forward rather than a neutral stance. Okay. And then on the right hand side, you've just got the frontal view of that. With those abdominal muscles tucked in and not keeping the back up nice and upright, you're not engaging that part of the core anymore. It becomes very lazy, which is why if you then sit yourself up nice and straight with your shoulders back, some people can't do that for very long because it's not a natural position for us at the moment. So just whenever you can, think about that posture, sit yourself back up straight, bring those shoulders back, focus on having a nice straight back with your chest up. And again, other things then start to fall into place. Overall, the body is really succumbing to the gravity and the misalignment of all the load on all of those joints. And over time, without correction, they can become almost permanent, semi-permanent. So, like I said, whenever you give it a little thought, sit yourself back, shoulders back as well, chest nice and high, keep that tummy nice and that core nice and engaged. There's the slide I was talking about earlier. So evolution of man at the bottom, all the way through to us now sitting back at a laptop. We took the laptop away, would look no different to we did at the very start of there. And it is becoming that bad. So as we want to increase as much activity in people as we can. Like I said, doesn't have to be the gym. If you've got a hobby that keeps you nice and active or outside, we use the allotment a lot here as well. With Everyone Active, we've got an allotment in Stevenage. So if gardening is your thing, that's certainly something you could get involved in. But if you've got your own garden, then that's also great. Anything where you're active, then I can't promote that too. So can't promote it enough. So by keep moving, the immobility causes weakness in those muscles, which is why we end up with that arch again that we're looking at. Try not to sit down for too long. That causes the muscle imbalances. Don't lift anything with straight legs. Again, if you've ever done any manual handling stuff at work, we want to bend at the knees, keep that back nice and straight, that transfers over to lifting in the gym for your things like your squats and your deadlifts. We mentioned Pilates and yoga earlier. We were talking about it as well before we all got on this call. It's great for everybody. I try and encourage all the guys that like lifting the heavy weights in the gym to go and do the yoga and Pilates, because the benefits to the longevity of lifting then really come into effect. You increase your mobility, and if you've ever seen, if any of you've got children or you've seen children, the way they can go from a sitting position to a very deep squat to standing up, that's something we should really all be able to do. We just lose that over time because we stop working those muscles in that way. And that's where the yoga and Pilates comes in. You then add a little strength work onto that, and we start to become more mobile. And that's the true, really sign of good fitness. The mattress is a great one. I'm rubbish at changing my mattress or flipping my mattress, but it makes such a difference. I think 10 years, that sound about right for getting a new mattress.
I mean, the mattress companies say 8, but I
8,
don't know
yeah,
whether it's a marketing thing or what.
maybe. But it can be massive. I recently got a new one actually, not very long ago. And it has made a big difference to my sleep. And it goes to, depending if you're a side sleeper or a back sleeper as well, will vary on that kind of severity. But make sure you go and test your mattresses, get a nice comfortable one that fits you. But yeah, if they're saying 8 years, I think I did 10. But do get yourself a new mattress if that's an option open to you. Okay, osteoarthritis. The most common form of arthritis affecting a third of people over the age of 45. Not everyone will develop osteoarthritis as they age. Now, that's an inflammation of the joints, and it can happen when cartilage covering the bone degenerates over time, causing pain, swelling, and stiffness. Can be caused by wear and tear, joint injury, age, or genetics. Can be incredibly painful. I've got osteoarthritis in my left knee. I've had a lot of injury. I think I've had about just over 23 surgeries on my left knee through varying ligament injuries over the years. And so my cartilage has worn significantly. But there are ways, again, to help improve that with good stretching and mobility and muscle imbalance, or improving muscle imbalance.
I'm just going to jump in here, Mark, from a GP point of view, because it says osteoarthritis is inflammation, and I think it's really important. There are inflammatory types of arthritis like rheumatoid arthritis, and from my point of view, I would say osteoarthritis absolutely is a degenerative condition, but I wouldn't say it's always an inflammation, because that would be more like the rheumatoids and the psoriatic arthritis, and the treatment options are very different. There are so many things now that we're thinking may be linked to inflammation, whether that's tiredness or irritable bowel or whatever it is. But I just think we need to be really careful that, because some doctors will be talking to you about, you haven't got an inflammatory arthritis, so we don't need to refer you to rheumatology, which is absolutely often the case in osteoarthritis, because the treatment options are totally different.
Sure. Thank you. I think we've got rheumatoid coming up next slide, I think. There we go. So large autoimmune system disease which attacks healthy cells and tissues mainly in the joints, causing swelling, stiffness, restricted movement, inflammation, and the joint pain. So less common than osteoarthritis, approximately 1% of the population, and usually in the 40 to 60 age bracket. So genetics, apparently studies have found that gene indicated has an increased susceptibility. Environmental triggers may be a link with viruses and infections. I don't think she meant to put that one in there, but then trauma, stress, smoking, especially if the smoker has a gene linked to the condition. Is that right, Tara? Smoking with
Oh,
rheumatoid?
smoking's linked with all sorts of things. I mean, what I would say that one of the other big differences is that I mean, rheumatoid arthritis does tend initially to start, as you've shown on here, a foot. It's
Yeah.
often small joints and it's often different joints. So it's certainly in the hands. With osteoarthritis, it tends to be the joints, the end joints.
Uh-huh.
And with rheumatoid arthritis, it's often across the knuckles or the next, the
Okay.
next ones along. And it is often a bit different. I mean, osteoarthritis, you often will just get maybe just in your knee or just in your hip. And I would say rheumatoid tends to be a bit more lots of joints because it is an autoimmune disease.
Okay, so that could be more full body or more full joints.
Yeah, I mean, it often starts with your hands and feet, but
Yeah.
you
Okay.
do sometimes see it but it's more the small joints than the big joints.
Sure. Exercise recommendations. So pain experience may cause decreased physical activity, as most pain would cause decrease, which can increase the chance risk of developing chronic health conditions. So it is important to stay as active as possible or more active, um, not only to alleviate pain, but to avoid developing other comorbidities. So the CV training, cardiovascular training, low to moderate aerobic activity, 2 to 3 times a week, depending on the severity of the disease, starting with 5 minutes, gradually progressing that up to around 20. But we still would be looking at a combination of weight bearing, so treadmills for your weight bearing, your walking, or non-weight bearing, cycling, swimming, uh, and depending on maybe your initial weight, something like a cross trainer or an arm cycle would be a really good one to use as well. Uh, and that bottom part's really that's key, and that's where everyone is so individual, and it's trying to find that fine line between making sure you are being active, but not overdoing it. And you're very much, the master of your own body, so you'll know what's causing you pain, um, and what's not. And to say it's important to try as many of those different things as possible to see how your body responds uh, to certain machines. Certainly with all the surgery on my knee, um, exercise bikes didn't really work that well for me, but cross trainers caused me no problem at all. Walking uphill, I always found no problem, but long periods of downhill walking would aggravate my knee. So I had to take all of these things to account when I was certainly going through all my rehab after the knee surgery. So you'll find what your body likes, what your body finds irritable. Resistance training. So love a bit of resistance training. But this can start with your own body weight. So body weight, squats, lunges, press ups against the wall. And again, it's important to work within what is your current range of motion. So if you was to type in how to do a squat on YouTube, you'd see someone probably go all the way down to below parallel with their glutes, maybe even touching their calves, full full squat. If that's not within your mobility range at the moment, that doesn't matter. If you can only do a quarter squat and it's relatively pain free, then you do a quarter squat, and we can help to work on that strength and mobility as you look to progress those sort of exercise. Flexi bands, so elastic, big coloured rubber bands that we use, really, really good for just giving that little bit of resistance. It's something you can do in your home. You don't need it at the gym, and you can do a full body workout with bands, and you can get them on most internet sites. In the gym with free weights, so your bars, your dumbbells, um, to perform those same sort of exercises with increased resistance. Fixed weight machines, so the stuff where you come in the gym that are on the cables, the chest presses, the leg presses, um, They're really good at isolating individual muscle groups, and you then don't have to look after stabilizing the weight. So again, less chance of aggravating any of those joints. It's a little bit more controlled. And again, you can still work within your range of motion. Water-based training. So swimming, aqua. There are some of the trainers over at the pool that do kind of rehab and prehab workouts in the water using, again, the kind of like foam type weights, and you're working the muscle in the opposite way, but really, really good at not aggravating the joints, and it's just a gentler way to build yourself into more intense exercise going forward. Rep range, anything between 5 and 15 reps has been found to be the most effective. But this again will very much on depend on what you've either done in the past or how your body feels doing a movement. And it doesn't have to be the same for every movement. So if you found 15 press ups very comfortable, then great, you can do 15 press ups and work to that rep range. If you're then doing squats, your knees, hips, ankles, wherever that pain might be, lower back, might only tolerate 5, 6, 7, 8. So you'll find what suits your body best, and then we make progressions on those numbers rather than sticking to a set number for each one and forcing the body to do something that's going to cause pain. And around 2 to 3 times a week for resistance training. You could then say do your CV, your cardiovascular, on the other days, and we can then get you active to that 4 or 5 times a week for, say, that 20 to 30 minutes. Flexibility. This is something that people should be doing right at the start of their training. I mean, so even in terms of age, I'd get them doing yoga and Pilates all the way from junior schools if we had our way. It's so important. It's the most neglected part, but it's also the biggest growing part of the gym world. Your yoga, Pilates, Tai Chi. We do seated Pilates and that here as well. If standing for long periods is one of the barriers, so we do seated. We do a lot of strength and conditioning, the chair-based exercises to help those who have got pain or stiffness in any of those sort of joints. So we're trying to offer as many options as we can that are not just for the mega fit that can go to any class they like. We do a lot of seated options or lying options, much slower paced classes to try and get you involved in just getting that body a little bit more flexible, a little bit more mobile, to enable us then to bring in the extra strength and cardiovascular exercise. So, extension on that recommendation. So ensure a longer warm up before exercising. So whatever that may be, and like I talked to, we'll talk from a gym perspective. If you're going to be, find what bit of cardio equipment suits you best. So if you like the cross trainer or the bike, get yourself on there, warm up for a little bit longer, approximately 10 minutes, building into that kind of resistance level. So start quite low and then just increase it every couple of minutes so that you can feel it. But nice, long, prolonged warm up. Avoid strenuous or high impact activities. So no sharp explosive movements. If you're doing squats, we don't want to see jump squats or jumping onto the boxes. It needs to be nice and controlled within your pain threshold, within your movement threshold. We want to avoid using heavy weights. Now, that's a very vague term because everyone is very different in terms of what they would consider light or heavy. So what it's got to be avoiding heavy weights, what is heavy to you. So start fairly light. You want to be able to do that first set at around 12 repetitions if you can. You can then gauge where you go after that. If you're finding it too easy and you think, oh, 12 was absolutely nothing, then we need to put the weight up a little bit. But we want to be feeling it the last few repetitions. That's when it wants to be not challenging, but you want to be able to feel that muscle working. focus on the good technique. So important, especially with a lot of the conditions that we've talked about. There are many ways to move a weight, but if we're looking at working on specific muscles, we just want to make sure we are activating those muscles, and not lots and lots of accessory muscles. So if you're using a sensible weight, the good technique becomes much easier to execute. If it's in the gym, speak to one of the PTs. They'll quite happily give you some guidance on that. If you're doing it at home, you can check out, there's lots of on-demand type of classes or instruction these days. But yeah, try and get that technique right. By keeping the weight light, that will really help that. Rheumatoid arthritis patients should avoid physical activity during flare-ups and may need a couple of days extra rest following if you do have a flare-up. Again, you'll know your own body. So if you have got that flare-up, you've got that pain, don't jump back straight into your workout routine at the gym the next day. Try and take it as a little bit more of a rest. Maybe if you can go for a walk, if that's not causing too much, or even walking in the pool is great exercise. Again, might help massage the muscles there a little bit with the water pressure. Exercise can help with pre and post surgery rehabilitation if joint replacement is required. But I think they generally get you up and moving quite early on once you've had joint replacement work done these days. I didn't have replacement. I had stem cells done with my knee. But a lot of the principle was the same in terms of getting the knee joint moving again and getting the muscles activated to try and look after that joint as much as possible. But we do a lot of rehab work here as well. So that's something, if you wanted to reach out, we can certainly help with.
Do you know, Mark, I think that's something people don't think about, is that actually that prehab, and partly because the wait lists have been so long, there has been a real push to try and get people to do some kind of prehab. And it obviously does make sense that if you've already got those muscles strengthened before you have the surgery, then doing the rehab afterwards is going to be easier than if you're starting from a point where the muscles were not in a great state to begin with. So I think, that is really key. And actually, exercise is often one of the things that how we manage osteoarthritis without, and then hopefully we can avoid surgery if that's the case. I think the one thing I would say with the rheumatoid arthritis is it's unusual for somebody with rheumatoid arthritis not to have a specialist. You'll almost certainly have a specialist. So if you've got any concerns or questions and you want reassurance, you always can speak to them.
Yeah, brilliant. So a couple of bits there. They've obviously taken pictures of the club. So the anti-gravity treadmill. If anyone has ever seen it or been on it or watched a video, so it takes away X amount of your body weight, up to 80% of your body weight can be taken off when you're walking. And the best way, I suppose, to describe it would almost be like walking in a swimming pool would be quite a close sensation, feeling. Really, really clever bit of kit. It's one of the things I went back on almost immediately. I think about 3 days after my stem cells were, and they let me up and walk in. And I used that a couple of times a week for about 3 months before I went back onto a normal treadmill. But really great. Although not part of what we're talking about today, but my dad's got Parkinson's, and this is something that, again, we use with him quite a lot, just for that imbalance he's got, and unfortunately has a few falls, bless him. This keeps you quite secure. So if you're worried about a joint, or you've had a surgery, you're quite protected in here. So you can't fall. If you were to trip or you lose your balance, the air pressure keeps you upright, and then just gives us time to press pause. You can get your feet under you again, and then off you go. And then the other picture is called a new step. It's kind of a cross between a recumbent bike and a stepper. So rather than the legs circling, it's more that step motion, that flat motion, but you get to work the arms at the same time. And then one we've not listed on there, which is right next to it, is for the upper body, and there's a unarmed cycle. So your feet are just planted flat on the floor, and you just work in the shoulders in that bicycle motion, but all for the upper body. There is a GP referral team here. Juanita, who sometimes joins us, runs that alongside Stephen and Tom. They generally make the appointments by booking, and obviously after referrals from GPs. But it includes the whole club, so you get access to the gym, studio sessions. We do, like I mentioned earlier, specific classes for uh, cardiac and pulmonary escape pain. So again, those joints or arthritis issues. We do stroke rehab, Parkinson's, weight management. We've got a Tanner scale here, which does all of your body fat, body mass, muscle, visceral fats, which gives us a really good overall picture of how your body is made up at that point. And then at the bottom, I think John was in the comment not so long ago, bless him. Still comes, was here this morning with me at 6:30, 91 years old. Won't leave until he's done his 100 sit-ups, bless him. Sometimes takes him a little bit longer than others, but he's been coming here for I think, since before the boss was here, and she's been working here 30 years. So yeah, very mixed and diverse place, especially in the mornings if you're an early person. I think that's the last one.
Brilliant. Thanks, Mark. While you were doing that, I was just trying to find, because I was fairly sure, which I've just found it, that Juanita had sent me, there's a GP exercise referral system, but you can self-refer with a QR code, and you just need to put your GP surgery into it. I found it, but I'm just wondering whether I can share it somehow. Maybe that's something, Dion, that we could put on the PCM website.
That'd be great.
With the QR code on it. So thank you. That was, I have to be honest, I was sitting there, and I'm sure we all were, a bit like when people talk about pelvic floor exercises, and as a woman you find yourself doing them. I was sitting there, I just put my shoulders back and tuck my tummy in. So we probably were all doing that. And I remember when I was at medical school, somebody saying, well, the big problem is the skull is heavy. And that picture with the mast with the skull on the top, it really demonstrated that quite well. That, actually we've got this huge heavy mass on the top of what's quite spindly. And so when we were, in fact, spindly probably comes from the word spine, doesn't it?
Yeah, it must do. Yeah.
Weedy. And it was all very well when we were on all fours, but as we've stood up straight, your back really struggles to hold that head up, and posture is really important. I think it's probably just worth mentioning, because obviously you're coming to this from a men's health point of view, that from a GP point of view, the majority of the scoliosis that I see is in teenage girls. So, and that is, what we call idiopathic, so don't really know why it happens, but a lot of them do need some intervention, which is either specialist physio or surgery. But actually in the older age groups, it can sometimes be because of degenerative things. And with all of these, with those sorts of conditions and the osteoarthritis that Mark's talked about a little bit, our practices have got access to first contact physiotherapy as well, so they can give you some targeted exercises to do for those sorts of conditions. So we've got a couple of questions in the chat, and if anybody's got any more, please do put them in. So we've got a question that says, is walking the dog for an hour every day enough, mostly forest tracks?
Yeah, I mean, it's certainly better than not doing it. So anything where you can get out. In fact, forest tracks, you're probably going to be using that core a little bit more than if it was a flat surface. So, yeah, definitely encourage that.
I think it depends what you're trying to get out of it. So certainly the cardiologist that we had talking to us was saying that, if you're not building up a bit of a sweat and getting your heart going, that isn't the, when Mark was saying about doing 30 minutes 5 times a week or whatever, walking, I mean, certainly my dog I walk the dog every day, but she stops and sniffs, and it's more of a meander than a walk, I would say. So while it's clearly better than sitting still, and it does get your muscles going, it isn't, if you're not getting your cardio going, it won't be doing that that element of it. But there's so much to be said for going out and getting some fresh air, actually, for your mental health as well.
Yes.
And then the other question was, is Pilates classed as resistance training?
Not say there's an element of resistance training in Pilates, and it depends on the type of class because there are many variations of Pilates. I would say most of the stuff we do here wouldn't be resistance, but depends. Yeah, it depends where you're going. So I know different classes do different clubs do different versions of Pilates, and you can certainly reach out to them to see which of those they are. But again, it's great core work, Pilates. So you are working that core a lot, and it does work for strength. With some of these moves and positions you have to get into, certainly the advanced ones are like tremendous levels of strength. So not resistance, but great strength training and great core and mobility.
I mean, there is, I don't know very much about it, but there's a bit of a, I'm not going to say a fad because that suggests it's going to go away, and I don't know whether it will, but there's reformer Pilates at the moment, isn't there? Which involves a fair amount of equipment. And I wonder if that might be more resistance than the sort of standard Pilates.
Yeah, that would yeah, without a doubt, that has much more of an element of resistance to it. I've only watched Reformer Pilates. I've not partaken in it myself, but yeah, you would be right, Tara. That's got more of a resistance element to it.
And for those of you who weren't at our talk with the cardiologist, he was talking about exercise and the importance of having various different elements to it. And we were just talking about this, weren't we, Mark, before everybody joined us, about the important that there's different elements, you know, there's the resistance, there's the strength, there's the balance and flexibility, and there's the cardio, and all of those are so important in maintaining your health, and they do it in different ways. You know, making sure that your balance and flexibility and doing things like Pilates and yoga in the long term can prevent people from falling, and that's really important, because obviously then if you fall, risks of injuring yourself, breaking bones, all of that's an issue. So, and the sooner you start doing it, the better, really.
Yeah.
Have we got any other questions for Mark? Well, that was, I don't think, well, let me just have a look in the Q&A one, because I've only looked in the chat. No, we haven't got anything there. Okay. Well, thank you everybody who's joined us today. And as I say, this will be on the website. So if you've got any friends or family who would like to watch it back, or if you want to watch it back because there's something you were missed out or don't remember, that's all on the website. Well, I'll get Dion to pop the GP exercise referral scheme form on there, so it's got the QR code and you'll be able to see it. We have got all of our other webinars there, and I believe our final webinar of the series is on nutrition and diabetes, and that's next month, which is on Thursday the 12th of March from 6 till 7 p.m. So hopefully we'll see some of you then. Thanks ever so much. Bye everyone.
Bye, thank you.